Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about the policy of care of elderly patients. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with follow and likes. This policy is applied to all hospital services provided to elderly patients. Purpose of this policy is 1. To provide optimal, compassionate, and competent care to frail elderly patients. 2. Improve patient outcomes, reduce adverse events and patient complaints. 3. To keep the elderly patients as active and independent as possible during the acute phase of their illness. 4. To reduce average length of stay. 5. To reduce readmissions within 28 days. 6. Cost savings associated with reduced length of stay and readmissions. 7. To detect and prevent dependent elderly patients from any kind of abuse or negligence. 8. To identify the documentation required for the care team to work and to communicate effectively. And 9. To identify elderly patients' monitoring requirements. 10. Staff satisfaction. Definitions. 1. Dependent elderly patient means any person residing in our country over the age of 65 years who has physical or mental limitations which restricts his or her ability to carry out normal activities or to protect his or her rights, including but not limited to persons who have physical or developmental disabilities or whose physical or mental abilities have diminished because of age. 2. Frail elderly patient. Patient over the age of 65 years, acutely ill, requiring medical management, has pre-existing comorbidities, at risk of functional decline whilst in the hospital, has experienced functional decline in 2 weeks prior to presentation to the hospital. 3. Acute care of elderly patient. It's a shared care arrangement between the admitting physician and a geriatric specialist based on multidisciplinary team approach from day one of admission. 4. Physical abuse. Physical indications of abuse occur more commonly in clusters of symptoms than as a single symptom. Assess for the presence of 2 or more of the following: bruises, welts, lacerations, puncture wounds, dehydration, malnutrition, fractures, Signs of over-medication, burns, poor hygiene, lack of needed medical attention, multiple injuries in various stages of healing, and injuries inconsistent with explanation. 5. Fiduciary abuse, a situation in which a person who stands in a position of trust with the elder willfully steals the money or property of that elder or expose the elder's money or property to any use or purpose not in the due and lawful excuse of his or her trust. 6. Neglect. It includes the following conditions: failure to assist in personal hygiene or in providing food and clothing for an elder, failure to provide medical care for an elder's physical and mental health, failure to protect an elder from health and safety hazards, and failure to prevent an elder from suffering malnutrition. 7. Abandonment. Abandonment means situations in which a person who has the care or custody of an elder deserts or willfully forsakes the elder under circumstances in which a reasonable person would continue to provide care or custody. Policy statement. Number 1. The care of frail dependent elderly patients is guided by appropriate policies and procedures. Number 2. Frail dependent elderly patients should be managed by a multidisciplinary acute care of the elderly team, which is a multidisciplinary team approach to patient care from time of admission. Number 3. Frail dependent elderly patients should be seen by social worker, dietitian, and physiotherapist within 24 to 48 hours of admission as a blanket referral instead of waiting several days. Number 4. Discharge planning should begin on the day of admission, including estimated date of discharge. Number 5. Hospital staff must report the abuse of elderly patients whenever staff knows that such abuse has occurred. Procedures. 1. Elderly patient is admitted from ER to the designated ward or ICU according to the nature or speciality of his illness. 2. Ongoing focus on function to pre-morbid level. 3. Assessment of risk of fall and manage accordingly. 4. Pain assessment and manage if any. 5. Reduce the number of moves between wards or departments as much as possible, preferably to be discharged from the same ward of admission without any transfer. 6. Reduce the length of stay as much as possible to reduce risk of healthcare associated infections and reduce risk of depression. 7. Patients are seen by social worker, dietitian, and physiotherapist within 24 to 48 hours of admission as a blanket referral instead of waiting several days. 8. Start discharge planning after admission. Prepare the patient, family, and allied health staff to properly plan for safe, efficient discharge, including estimated date of discharge. 9. Patients are encouraged to walk to the bathroom instead of using a commode chair. 10. Patients sit out of bed most of the day, except for a rest period in the afternoon, to reduce risk of thromboembolic complications, bed sores, and depression. 11. Patients are encouraged to eat meals in the dining area for socialization. 12. Some patients don't like being called elderly, even if they are over 80 years old. 13. Key performance indicators include reduced length of stay, increased patient and staff satisfaction, decreased adverse events, and reduced access block. Responsibilities. Multidisciplinary acute care of the elderly team consists of admitting physician, team leader, initiates the patient plan of care according to the current medical condition, for example, surgery, ophthalmology, etc. Geriatric staff specialist, if available, care for the special needs of elderly patient age group. Nurses provide most of the frontline services. Physiotherapist to regain the best available function and fitness. Social worker report any abuse or suspected abuse of frail dependent elderly patients to the appropriate authorities. Document in the patient record that the call or report was placed. Dietitian, nutritional assessment and plan. And pharmacist review all medications to be suitable for elderly age group, especially doses and side effects. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.